actually really good. I think what I've loved the most is the connections, and also just having my thoughts challenged and inspired by a lot of the things going on within South East London actually and beyond.
I have loved today. We were really lucky enough to be part of the expo as well as joining the conference, and it's been fantastic to meet so many people, so many contacts, kind of old contacts that I've only been meeting on Teams or Zoom, now get to meet in real life, but also making new connections.
I think the key thing I've enjoyed today is the networking with people, meeting them face to face and making that connection.
I've made some key connections through individuals who've known about me, I've known about them, but we've never actually kind of got together to see what the possibilities are. So I'm going to be committed to making sure that there'll be some follow-up.
Today has been fantastic, very energising, wonderful to get to meet and chat to colleagues that I would never have had interface with before and really start to understand more around the population that I'm working with.
I was able to make a connection because one of the things that we're looking at is how we can employ people with a learning disability and autistic people within our anchor institution. So I've made some connections there, which I'll follow up.
I need to think really quite carefully about how I can contribute and help to further the population health management agenda in South East London, how we can make sure it really adds value, adds value to people's lives, how we use data intelligently.
When we think about the Vital Five, we then think after the initial conversation and after the next point where you get somebody's data, what happens next? What happens to that data?
Biggest thing I've taken away today from the conference is that people are our biggest asset, and it's about how we use up the people within the organisation, but also leverage on the technology to deliver the best care we can for our patient population.